My name is Ohia Chidera Christabel. I'll be presenting on glycine receptor, that is the G. So now, what are glycine receptors? Glycine receptors are pentamerically conjugated ion channels, meaning they are composed of 5 protein subunits that form a pore through which ion flows when the glycine binds. They form a pore through which ion flows when the glycine binds. Now, these receptors are also crucial for the inhibitory neurotransmission in the central nervous system. Now, the glycine is a pentameric receptor, like I said before. It has subunits, which are the alpha subunit and the beta subunit. The alpha subunits they bind the glycine directly, while the beta subunit they are responsible for anchoring the receptor to the posympic density. The central pore is selective of chlorine ions. Now we have pore signaling steps, which are the glycine. A few things about the signal earlier. Firstly, I'll start with the glycine uptake and signaling. It's when the glycine enters the cell via cell transporters along with sodium ions, or activate the glycine receptors, which are chloride channels, leading to the change in membrane potential, that is the VM, and potentially intracellular chloride levels. Secondly, we have the calcium influx. It is the change in membrane potential. It can lead to the opening of the voltage-gated calcium channels, resulting to an increase in intracellular calcium concentration. Thirdly, we have the role of the NKCC as the sodium-potassium chloride co-transporters that help maintain the high intracellular chloride levels, which can influence the direction of chloride movement through the glycine receptors. Then lastly, we have the downstream cellular effect. The increase in the intracellular calcium, it triggers the glycine signaling. It's linked downstream effects such as cell proliferation, differentiation, and migration. The disease associated with glycine receptors, I'll just mention list 3. We have the Startle disease, we have the spinal cord injuries, we have the stiff person syndrome, and there are other neurological disorders like the neurological conditions such as epilepsy and chronic pain.